So let's talk about class 2 antiarrhythmic medications. These are known as beta blockers. Remember, no bad boys passes cops. So these are beta blockers. And the drug name for any drug that's a beta blockers always ends in laughing out loud. Huh? Wait a minute. No. Oh, yeah, LOL. Ah, I know. So whenever you see a drug that says LOL at the end of it, that is a beta blocker. Now, there's already a whole lecture on beta blocker that has been created already. Just go to the cardiovascular section and click on beta blockers and you'll be able to watch the entire lecture on beta blocker. In this lecture, we're only going to focus on the antiarrhythmic effects of beta blocker. So, the drugs are sotalol, propranolol, and esmolol. Esmolol. And you can see LOL, LOL, LOL. Okay? Propranolol, esmolol, and sotalol. Those are class 2 antiarrhythmic medications. They are beta blockers. So what is the mechanism of action of beta blockers? Well, first of all, we know they block beta receptors. So that is common sense. Let's keep that easy. Mechanism of action. We know they block beta receptors. But they do a little bit more than that. So let's take sotalol, for example. It decreases automaticity. Decreases automaticity. Well, how does it do that? Well, the SA node is the automatic jump starter inside the heart. But it also has beta receptors on it. And remember how you get that nice little graph for the SA node, where you have sodium influx, and then you have calcium influx, and then you got potassium for repolarization, so depolarization and repolarization. Well, once you use a beta blocker, overall there will be decreased influx of calcium inside the cell, which is going to decrease the depolarization of the cell, which eventually is going to decrease automaticity, which is going to slow down the SA node and the AV node. Okay? AV and SA node are slowed down, right? So it's not constantly firing, it's firing slowly. Well, we're going to talk about why they cause bradycardia in a minute when we talk about side effects, but when you can see slow depolarization, I mean there's slow heart. So after that, it also prolongs the AV refractive period by both blocking potassium channels. They can also block potassium channel. But when they block potassium channel, they also in that avenue slow down the AV node. They slow down the AV node. Okay? So what do we use these medications for? Ventricular arrhythmias and supraventricular arrhythmias. So this lecture is very, very easy. Super up and down, up and down. That's basically what we use them for. Supraventricular and ventricular arrhythmias. So clinical use, supraventricular. We're talking about sotalol, by the way. Supraventricular arrhythmias, okay, and ventricular arrhythmias. So just to kind of reiterate, just in case you forgot, we're talking about atrial fibrillation or atrial flutter. Now, think about it. In atrial fibrillation, the heart rate is going at 120, 130s, 140s, right? Irregular heart rate is beating so fast and the patient is becoming hypotensive. Now, in order to slow them down, slam some brakes on it, we call that rate control. We control the rate at which the heart is beating. So let's use a beta blocker to slow them down. Block the road, right? So we use a beta blocker. Okay, beta blocker. Slow the rate down. Okay, all right. Slow down. I just want to get to know you. Well, that's what the beta blocker is doing. It's